And we're back talking about the need for more preventative health care in Canada. Dr. Borjesson, before the break, you had just started to explain what's known as PAP in Sweden, physical activity on prescription. Could you just explain how that works?
Yes, I would glad to. PAP stands for physical activity on prescription, and it's in some ways similar to exercise is medicine that you have in the US. But I do think it differs in some aspects. The model, the Swedish model, has been introduced for 20 years ago and has been refined during those years. And we, of course, we have a lot of mistakes that I think we are very important that we share among similar challenges globally. But part of the system is that you go to your general practitioner or your responsible doctor or your healthcare personnel that you are with your personal problem, and then you can get prescribed activity for that suitable activity. But it should be individualized, and that's the key. Not one size fits all. It should be individualized according to the disease, of course, but also according to other diseases, concomitant diseases, or medications, or your level of interest, or your motivational
Mhm.
aspects. So there are several things that makes you adjust and make the prescription individual, and then also the follow-up should be individual, and the length of the is not a time limited thing. It's a life changer for life. So you
Mhm.
should be followed up on that. I also think it's very important that such models are evidence based, that you can prove, and
Mhm.
that has been shown by the Swedish model in systematic reviews, that you do actually increase the physical activity in individuals who get prescribed according to this model. I do think the key is individualization. It's also that it's evidence based, not only physical activity in itself, but the method. And maybe the most important thing is that it's supported by governmental support, money wise, but also
Mhm.
in national guidelines and in committees on physical activity and so on from the government, but also in a system that's the knowledge based national system for treatment models, that so it gets into each different disease when it's appropriate, of course.
And, I came across this model earlier this year when we were doing research on preventative healthcare, and I was fascinated by it. And in particular, a couple news stories where they talked about the importance, not just for doctors to say to the patient, okay, you should be exercising more, try and walk more or whatever, but the idea that there's an actual prescription, something physical that they hold in their hands. And I thought that was really interesting how it seemed almost like patients take the advice and this plan more seriously than if it's just kind of a verbal thing. Could you explain sort of how the medical system comes up with a prescription in Sweden and in cases where patients need more activity?
Yeah, it's very important that all the prescriptions are based on. And in Sweden we have a big reference book called the FIS book, which is freely available in English and
Mhm.
www.fis.se. And there you can, or .com, I think, maybe. But the thing is that you have the different prescriptions for the different diseases based on the evidence for the suitable activity for that kind of disease. But this is the starting point only, because then you have to
Mhm.
adjust this prescription according to the individual you have in front of you, according to all these parameters I mentioned before. And I would also like to mention that this has been a work from the Swedish Society of Sports and Exercise Medicine and the working group on physicians, professional physicians for physical activity in Sweden.
And how effective has the program been in terms of patients taking these prescriptions seriously, and changes in behavior? Like, are you seeing the benefits in the healthcare system?
Yeah, I mean, what we can say is that the compliance is similar to what we can see from medication, because not every patient take their
Mhm.
medications. There are many medications in the cupboards back home in different, in the houses and apartments. So the uptake is about the same, the compliance. The effects,
Mhm.
long-term effects, has been shown in a recent study we did, has been up to 5 years. So there is a maximal effect sort of after 3 to 4 years, but that's pretty long. I mean, and you can add to that prescription, so it makes it even longer in duration.
Okay, and we'll be back more talking about Sweden and preventative healthcare in just a moment.